right, everyone. Welcome to SPRY Sessions. This is our third podcast. And joining me today, I have Dr. Alex Bendersky, who is going to be joining me to discuss our exciting topic of digital AI scribes.
Excellent. And thank you, Dr. Minal Patel, for having me on this wonderful podcast. It will be a direct conversation and really looking forward to having this discussion.
Wonderful. So let's just dive right into it. I think the initial conversation about digital AI scribes in physical therapy setting, especially in the outpatient setting, I think has to start with the definitions, right? This is such a new technology, such a growing, fast-paced technology. So what does it even mean? What does a digital AI scribe mean, Alex?
Well, it's a terrific question, and I think we can go into the benchmark of the digital AI scribe from how it has been built and also how it is being utilized. And digital AI scribe uses ambient technology to collect data on like specific features or I guess rules that are set up through the EMR platform to capture a subjective narrative from the conversation between a practitioner and a customer or patient. And so these rules can be customizable based on a platform or can be generic based on just as obviously the types of data that you're trying to capture. I think it would be wonderful, if you just go a little bit into our specific AI scribe, which I believe, if you look into the industry standards, really does a much better job than some of the other products in the market at both helping the clinician, but also maintaining this data salience, this data quality that is being captured.
Absolutely, yes. It's on SPRY AI Scribe feature. It is sort of one of those top-notch features that our engineering team has built from the ground up that can be directly embedded into the EMR EHR system. And so, the pros, the pluses of that kind of a feature is it is not a plugin, it's not an add-on, it's not a secondary feature that has to be opened up separately from your documentation workflows. It is directly available right within your templating. That's the first pro, I think. Second pro is to, as you mentioned, being able to create the rules around what it is that you want this scribe to capture. Because let's face it, and this is a question that you and I can probably discuss in a little bit as well, Alex, is while there is a lot of kind of consistency required in our documentation and considering outpatient physical therapy, for example, what we should have in the subjective section, what we must have in the objective assessment plan, et cetera. There's still quite a bit of subjectivity to that in terms of what the therapist or clinician wants to be able to capture and add into their notes or into their documentation. And so when it comes to the digital AI scribe being embedded within SPRY and being optimizable and customizable to how you perform your documentation, workflows and the content of what you write in your documentation, that's a huge plus because you're not going to be dictated to say, hey, well, you need to have, XYZ and the scribe is going to output this and therefore this is what you're going to have in your system. It's very fluid in the back and forth of how the clinician wants to be able to mold that scribe to be able to then perform the documentation in their style. And so I think overall it is a feature that because the rest of our system is so customizable and so configurable, the SPRY AI scribe feature had to be the same way. And so, our current clients that are using it see quite a bit of ability to kind of capture the things that they need to capture in the way they want to capture without being stuck to certain, workflows.
Wonderful. And I think that you go directly into probably the biggest value allocation, which is how a feature is being integrated into a platform. And I think the biggest beneficiary here with SPRY is that it's directly embedded into the platform because it's grown together. So the organic growth reduces that some of the fractured, poor interoperability that you see with platforms that grow through acquisition. And so this growth through acquisition, then it's a time where you have a lot of cousins but no siblings, right?
Right.
So cousins are great, and you can have wonderful relationships, but it's still not the same as being a sibling where you just directly come from the same seed. And so with a SPRY ambient AI feature or a Scribe feature, this is something that has grown together with the rest of the platform. So that interoperability is seamless as well. There's an interesting concept of called click fatigue, where there's a X amount of clicks that a person can do before they get tired of it and become complacent. And so when you grow something organically, you don't have that click fatigue because everything is just operates the way it's designed to. So that this is great. So let me ask you this then, Minal. Based on how it is built, what is some of the feedback we're getting from the community about this feature, and how are some of the people using it?
Absolutely. Yeah, great question. We get back quite a bit of feedback on this AI scribe, especially I think for two reasons. I think one, there is quite a buzz in the industry of using AI scribes and the next technology. And it's not just obviously in our working world, we use it in outside in our personal lives quite a bit as well, right? So it only is, I think, natural for it to now kind of feed into your working world and help you get efficient in those aspects as well. And then two, in physical therapy space, I believe is a real opportunity for our organization and our our profession to really take that next step into providing that level of care that we know we can provide without having all the burdens that we have for documentation or charting or EMRs and EHRs and all of the things that we need to do around those. And so I think that's the next step for clinicians to really free themselves of a lot of the burdens that kind of pull them down and be able to then go into the next phase of really honing in on their patient one-on-one care. And not that they weren't doing it before, but at this point now it's just easier to capture because this digital scribe is now available, in our technology. And so direct feedback, what we're getting is the ability to easily access AI Scribe. And as I mentioned, it is directly available on your templating. As soon as you open your template for documentation, it's right there. It's an app that you click on, and it is a one-step, two-step process where you hit play, it records it. And I think the other option, the other feedback we get too is that you have options as well. You don't have to capture the recording of the session, you can dictate as well. And so depending on the client's, kind of setting and their patient caseload and how they believe that their patients are going to interact with them in the scribe feature, it helps them kind of choose what they're going to do at them in that moment. Do they want to just verbalize what it is that they want to have, go into their templates, or do they want to actually record that interaction? Also very simple to use. There's not a lot of clicks and buttons and steps that need to happen in order for this whole process to be completed. And so that's the other feedback, I think, for people to have it simple, because as you know, Alex, in an outpatient setting, when you're busy, when you've got multiple things going on at the same time, the last thing you want to do is have to fumble with technology, right? You don't want to have an extra added step to between your interaction with your patient. And so the ease of use within the system for Scribe is also another feedback. That's on the sort of the technology side. On the clinical side, what Scribe AI is able to capture and output is another important piece that we get feedback on quite a bit. And so the idea is that as the physical therapist, you are having that conversation with your patient, you're saying your details out loud, which of course, and this is maybe we can touch on this a little later, is a little different maybe in terms of how we typically document as a profession. We don't always say things out loud as we're typing them out, traditionally. But the ability for the AI scribe to capture whatever it is that is being spoken out loud, and then analyze that and understand what is clinically relevant and what is not clinically relevant, because of course we have all kinds of conversations with our patients that are going to capture all those elements. And so it'll capture what's clinically relevant and then use that clinically relevant information and input it directly into your template. And that's the other biggest differentiator between the SPRY Scribe and any other product out there that is doing this. It's going to directly input the details into your particular template area. So for example, pain details goes into the pain section of your template. Range of motion goes into the range of motion section of your template. And that, of course, allows the therapist to, again, have freedom in not having to cut and paste and not having to move things around and not having to, just see blobs of information spit out. It actually gives them very detailed information within the template, which of course is always editable. And so at the end of the day, as a clinician, you always have that last say in what is going to be then your finalized note. And the quality of what Scribe is able to capture and clinically output is another piece of feedback that we get. It's also places where we find that clients also want to maximize a little bit of that optimization and customization ability, where they'll tell us, hey, can you output my information in a simple simple example is in a bullet format rather than a paragraph format. And within Scribe AI itself, you, the clinician, can prompt the Scribe to do what it is that you want it to do. And so I think that's another piece of learning that has to happen around clinicians as well as this new technology. It's really something that you can model and optimize and prompt to put out there what it is that you want. And so different types of prompts that are out there for clients that they can enter in. And if they really want the machine to learn faster than what it is currently doing, they just send us a message and our AI engineers will work on that on the background for them and input all of that information in on their end. So, it's a team effort on the user as well as on the SPRY side in terms of how they want to be able to customize this app for them.
I think it is so wonderful that you mentioned these functions, and I think that there's really three things to review, right? So the first one is that the ability to capture data. I think you and I are both clinicians, and we understand how that just the level of attrition of high quality data that goes missing from a traditional non-scribe based paper documentation or like the EMR documentation, where you just don't have the capacity nor the ability to capture 100% of relevant clinical data when you're interviewing a patient. And I think what the Scribe feature does is it captures all of it based on the parameters you set up. So you have this qualitative data capture that really helps you organize your clinical thought process and the plan of care accordingly. Versus, again, the traditional model where you just have to think back and you only capture data based on some of the heuristics that you're just clinging onto, right? So you're fishing for this information. Scribe eliminates this fishing feature. So as a clinical community, I think we need to really embrace this high quality data because there's value to this data, both to the patient, but also to the provider and also to the payer, because every segment, every step of the way of care provision cycle, this data will have a relevant function. The second part I think that's really important to mention is the value of communication that you were referencing, Minal. And this communication, I think as soon as a therapist has a computer in front of a patient, you're building a wall. And this wall acts as a barrier to an effective communication style because you're no longer talking to a person who needs your care. You're talking to a computer who's talking to a person. And this third entity, this computer, actually creates this communication barrier to both parties involved, to the clinician and to the patient. And that barrier doesn't need to exist when you have features like a Scribe existing where you can then just seamlessly capture some of this data through your natural interviewing cycle. I think, Minal, what you were mentioning absolutely also resonates is that once the patient understands that you're recording the information, the communication becomes much more pertinent about the reason why somebody's consuming care. So you're able to zero in on the exact reason for that individual pursuing clinical services, which again captures a much more vibrant clinical data point. So this communication piece should not be undermined, where we need to communicate. One of the key features of clinical encounter is what's called the patient-centeredness, right? And therapeutic alliance. And this therapeutic alliance can only be achieved when you have a very seamless communication style. So as long as you don't have this barrier of a computer in front of you, communication is improved, patient satisfaction is improved, and again, you're capturing a lot of data. I think lastly, what's really important is that customizable feature that you're referencing, where I think we always need to remember that a clinician is the designer and executor of these scribe features. So the scribe performs a service, and all of the services within a scribe are features, but the clinician has the capacity to control the level these features interact, both from the very low end, where you just record and then transfer the note, to very high end, where you execute these specific features specific to your niche presentation that are so important when you're trying to create a proper clinical product in terms of your service delivery. So yeah, this is great. This,
Yeah, absolutely. I love, Alex, that you pointed out this communication aspect as well in a little bit more detail, because that's the other thing I think that our clients are, sort of experiencing. We have clients, of course, that are, one therapist, mobile practice using this sort of feature to disciplinary, large organizations using this feature. And I think in all settings, it is the ability to really stay one-on-one with that patient or that client that they're treating, and be able to really impact them outside of this technology in the way, right? So you can also use Scribe on our provider mobile app that we have, and so no computer at all. You just take your phone, you click record on the phone, and there you are in person with that patient, one-on-one, no technology around you to kind of get in the way of that interaction. And I think on the patient end, that sends a very direct message to them, I believe. Being in the clinical world, we understand this, what our patients are looking at when we view them and they're looking at us. We can understand what they're seeing as well. And when they see barriers, sometimes they're going to start, kind of falling away from that lock-in into physical therapy. But here, they don't see those barriers. They won't see that in between. They'll see you, and they'll see what you are kind of performing with them. And that, I think, sends a huge message to our patients in terms of our ability to create that therapeutic alliance with them, their buy-in. And then, from there on, of course, it's a much easier process to have them stick to their plan of care, just because we've set that, especially in the beginning at that initial evaluation, when quite a bit of that documentation is necessary, right? We need to be able to capture a lot more detail on that first visit, and this way it sort of sets the tone for the rest of their visits when we have that kind of therapeutic alliance.
yeah, I think right on. And I think if you look into the nature of our industry, that we don't have a single point encounter. We're not like traditional medical care where you can have one episode of care and then you don't see the professional for another year or two. The nature of physical therapy or allied health sciences is that there's an ongoing basis of an encounter. They can last 6 weeks, it can last 8 weeks, it can last 12 weeks. And so each episode of care within that 12-week parameter needs to be a continuation, and you need to build on the previous episode. And I think a traditional non-digitized model of care, there is just a significant attrition of information between episodes. So each episode is like a new episode. So you're reliving like a Groundhog Day, right?
Yeah.
Think of like each episode of care, you're putting data, information into this bucket. And in the traditional model, the bucket is leaky. So you have all this information that leaks through, and maybe you have something on the bottom, but the rest of it is gone. So you just have to reestablish this context. When you use features like Digital Scribe, the bucket is whole. So every time you put new data in, you can reference prior points of data, and you can reference prior encounters. So each visit builds on a previous visit. And I think that's a way to provide much better qualitative encounter to the patient and to the payer, because you no longer need to reestablish, rebuild this low value processes, right, of re-interviewing. And if, especially in today's economic burden where the clinics are busy, clinicians have to see multiple patients, the less effort they can make in developing this communication through features like Scribe, the better it is for the patient and the therapist, because you no longer have to consume this energy doing something that's either meaningless or redundant, right? So you reduce that redundancy. So yeah.
Absolutely. Yeah. That's, at the end of the day, as clinicians, as therapists, we are doing the work anyway. We know what it's like to be in an outpatient physical therapy setting, and the the requirements and the additions and the, you know, the places that we need to kind of make sure that we're ticking the boxes off and all of those things. And so we're doing the work anyway. Let's have something that will help us be more efficient around that work, number one, but also lead us to be more truly what it is that we have set out to be in this profession is providing that one-on-one care with that patient, and over a length of time that helps them kind of go from, as you mentioned, like maybe, you know, a very basic issue to, hey, let's get you more further into your functional improvements, or let's get you doing more movement and this and this and that. And we're not necessarily stuck to just the one thing, because now we see what were we working on at initial eval, what was the thing that we needed to improve on, and that clinical summary over time that AI can give you is you know, something that we can really utilize in one-on-one care with the patient, but then also, as you mentioned, to the payer. The payer is now going to see exactly from step 1 all the way to step 10, maybe, you know, visit 10 that you're seeing this patient for, exactly what path they followed, instead of you having to remember and manually input this information. So I think personally, as a physical therapist, I think this is something that is inevitable for us as a profession, that, you know, maybe hopefully 5-6 years down the line, we're going to see almost every clinic, you know, whether it's a mom and pop shop to bigger organizations, utilizing features like this, because it's going to reduce burdens, but at the same time improve the outcomes for patients as well.
Wonderful.
Obviously,
Yeah.
I was just going to say, obviously, there could be challenges associated with a feature like this. So that's maybe the next step that we kind of discuss
Oh, yeah.
is, what, if any, do you see maybe currently in the place that we're at, when it's a sort of a new feature or a new kind of technology, challenges that we might face, and maybe down the line challenges that we might face with this kind of technology.
Yeah, I think that's right on. I think it's always important to not just be over optimistic, but really discuss the reality of using emerging technology, with the fact that it is an emerging technology. So you look into that, how stable is the system? And I think, just as we mentioned before, that there are going to be caveats. The system is going to operate at 99% efficiency, right? So there's always that 1%. It's going to be inefficient. And fortunately or unfortunately, the human nature is that we're going to notice that 1% much more than we're going to notice 99%. So when something works 99% well and 1% poor, that 1% poor is going to be much more resonating on our mind. But there's also I think a part where a clinician and or a consumer, a user of technology, is the gatekeeper of how this technology evolves. And there was an interesting quote about technology from one of the founders of Microsoft, in the fact that today's technology is the worst it'll ever be, because the nature of technology is that it evolves over time. So today's SPRY Scribe feature is, as wonderful as it is, it's the worst it's ever going to be, because it's only going to get better from here. And so as we build it, as we refine it, as our community of professionals and clinicians help us build the feature, it's only going to improve from the state that it is right now. And the biggest benefit is, again, as Minal, you were mentioning, we are building it together. So the entire product is evolving together, rather than just each product evolving separately and then just has to be jammed into this one entity that has to work together. So there is that part that you definitely have to be open, that human in the middle, right? The clinician in the middle. Clinician has to be the one reviewing the notes. The clinician has to be the one integrating the notes into the system. So you cannot 100% trust technology, just like you cannot 100% trust your car, right? You have to maintain your car, you have to do oil changes, you have to do other things to make sure that it's operational. Same goes for digital scribe feature, where while it is a tremendous time saver and effort saver, a clinician has to be the one reviewing the notes. Clinician has to be the one finalizing the notes, so that we know that there's a high level of reliability, right?
Absolutely. Yeah, very important pieces to consider. You know, obviously, as you mentioned, with technology, the risk of bias in the output, you know, that is possible. Hallucination, of course, is possible with AI. And so at the end of the day, the human in the middle, I believe, is the most important piece, you know, to be able to put all the features together and use them is one thing. and have them available to you is one thing, but as a clinician, as the human in the middle, that is the most important piece, because whether it's a feature like this, a Scribe AI, or our AI facts feature, or any other AI that you might be using in your personal world as well, you, the center, the human, is going to be the key piece to make sure that it is what you want it to be, how you want it to be, where you want it to be, and make sure that it's, not going to depict something that you don't want it to. But, the systems out there make it easier for us to do that. So the technologies that you are using that are, in your personal world, that are AI based, for example, they make it easy for you to, either say, no, I don't like this output, or yeah, this is great, I'll use it. Same thing goes in the SPRY AI Scribe feature. It's totally up to the human at the end of the day, whether they are accepting, what it is that's spit out into that pane part of the template, or they're editing it, they're manually changing it, they're dictating it differently, or they're prompting the scribe itself, themselves, and typing out exactly how they want it to be. So at the end of the day, I think when this technology first came out, there was a little bit of chatter on, well, is it going to take away the clinician judgment? Is it going to take away the need for the therapist to ever even be in the middle? And I don't believe that's ever going to be the case, whether it's 5 years down the line or 10 years down the line. At the end of the day, especially in healthcare technology, the clinician, the provider, the therapist is always going to be that ground, or that base that is going to kind of things are going to move forward from.
Yeah, in the words of again, I forgot who, but trust but verify, right? Like you can trust technology to do its job, but you still have to verify. And if you don't verify, then like ultimately large language models and AI is nothing more than a logical tool that recognizes the different data inputs and then gives an output based on the most likely probability of the next sentence, the next iteration, right? So when you are using a digital scribe instrument, it captures audible data and then converts it into language. As a human, as a provider, you still have the responsibility to ensure that the data that it captured is the data you want represented in the note, and if it directly reflects that encounter, because a traditional clinical encounter has a lot of contextual nuances associated with it as well. So then, even if there's a language used, there's a context that needs to be integrated into the node. And I think having a seamless feature like this, especially if it's integrated into the app where you can just use your phone to capture data, it is so wonderful, and it liberates so much of clinicians' time, that spending a little bit of time actually reviewing and ensuring that the vitality of the node is the least that we can do to ensure that there's a function that is uh, optimal, and that is both optimal in terms of compliance, but also optimal in terms of the data capture.
Absolutely. I have a story for you. One of our clients said to us, I typically use a template, and I have this conversation with my patient on the subjective side. I type things out, we talk about it, I type it out. And then I move on to my objective testing, and I look at their range of motion, I look at their strength, I look at their special tests, and I enter it into my template, and so on and so forth. And he said, now I'm using Scribe, and I'm verbalizing, of course, we're talking about the subjective side of things. And now it comes to the objective side, and I have to verbalize range of motion is XYZ and special test positive for XYZ. And all of a sudden, my patients are paying more attention to what it is that I am saying. And they're asking me, what does that mean? And how will that improve, if it's going to improve with physical therapy or not? And will it matter if it's XYZ now, and it changes down the line, and how is that going to change for me in function, and what I'm going to be able to do for mobility and activity and sports and things like that. So what he was saying to us was, our conversations now are more kind of inclusive of the patient when it comes to their plan of care, when it comes to what it is that we're going to be able to do for them in physical therapy, and how we're going to be able to affect them, because they're understanding our clinical knowledge with a little bit more depth, because we're saying it out loud now, right?
Yeah,
And so
absolutely. Yeah, that's
yeah, I thought that
self-validation.
was a really cool story to kind of understand. And this is just one small example, but of course there's many others that I'm sure conversations are kind of moving towards that for patients, and rightfully so. I mean, again, that's how we, I think, can build more therapeutic alliance with our patients as well, build that buy-in, build that trust in us as MSK, providers, right?
There's nothing worse than this moment of ambiguity when
Yeah.
you, especially if you're a consumer and you're in your physician's office and they're just typing away, you're like, What are you typing? Like, what's there?" And it's the black box phenomenon. Like, what is it that you have to type so aggressively that doesn't reflect on what I said? So this communication is exactly, it's right on that patient-centeredness. That now the patient is not just a consumer of services; he's a participant or she's a participant in service. Once you're a participant, you're an agent, right? You level the playing field where the consumer, the patient, is an agent in care provision and the provider is an agent in care provision. And together you're aligned in what it is that's important, which is getting the individual to improve, to reach their goals, which I think this is the greatest liberation of services where you're not focused on just typing and documenting, you're focused on interacting and having a conversation with the patient to align what it is that they're trying to achieve. So it's right on. It is so wonderful. So for the next iteration, I wanted to take a little thought experiment, right? And let's do an economic thought experiment because I think as clinicians and as professionals, we're so focused on production economics, which we want to provide care. We want to obviously, healthcare is an industry, and so the more care we provide, the more we can capitalize on it financially. But we never consider the time economics, where like what is the time actually worth of clinical encounter? And if you consider the time economics, it's actually much more pertinent than even the production economics, how many patients you can see in a day or how many new evaluations you can have in a week, right? Those are the key KPIs that a lot of clinicians or professionals track. But time economics is what is the value of 1 minute of your time engaged in a clinical encounter based on a traditional real world scenarios in the United States, right? So if, and this is an overgeneralization, but for example, if a traditional staff physical therapist salary is $60 an hour, right? And a net revenue per visit for a clinical encounter is $120. And if a note, just your soap note, takes 6 minutes to complete, right? Should like again, just overgeneralization. What is the economics? What is the actual cost? And what is the saving if you save this provider 1 minute of their time by using a feature like Digital Scribe? So what is the cost of 1 minute of time saved from documenting soap note? And if you just do that, again, overgeneralized $60 an hour, $120 net revenue per visit, each minute of time saved will bring back $21 of revenue to the organization that is using these advanced features like Digital Scribe, which if you think about it, the optics change very quickly from like it's a toy, it's a feature, or it's nice, it's a nice gadget to oh my God, this is actually important because again in a present landscape of U.S. physical therapy economics, where every dollar counts, right? Every dollar goes a long way, and we are being pressured by CSM, by other organizations to provide care with specific contingencies. Like if you save 1 minute from documentation time through a feature like Scribe, you are actually generating $21 of revenue. So what other feature generates revenue passively by actually just being present to a consumer? So I don't know. What do you think of that?
Yeah, I think it's an absolutely important piece of you know, use of this kind of feature as well, because as you mentioned, it can on the surface look like a nice to have or a comfort kind of a thing, or some are going to call it well, you're not really doing your job if you're letting AI do it, which of course is not the case. But on the surface, it can look that way. But really, when you go in depth with it into organizations that are using this kind of technology, what does it mean on the bottom line? And the time that you are saving for your clinicians as a provider themselves, what the time that they're saving need not necessarily be time that they're going to now, well, I'm going to add on another patient to my schedule because I saved, X amount of time. That need not be the case either. So I think it's important to, see it on a staff level as well as on a business level. That's not necessarily what we're talking about here. Well, because you saved 1 minute of time or 2 minutes of time, that now you can do something more to bring in revenue. The idea is that your time is just as valuable whether you're seeing a patient or you're following up with that patient or you're updating their programs or you're following up with their physician in their care, and that time spent is just as much important, right? So that the economics of using something like this at the end of the day frees you up to be able to do so much more as a provider and as an organization. That in itself brings in that value, right? Because we all know patients don't necessarily come to you as a provider only for one type of thing, right? They're coming to you because you can affect their pain, you're kind, you're gentle, you've got empathy, you have time to listen to their discomforts and their limitations, and they're not coming to you just for one thing, typically, because we are building that relationship over 6 weeks, 8 weeks, 12 weeks with them, right? And so when we show that we have this capability to provide this time, it generates in other ways. Maybe they're going to refer other people. Maybe they're going to spend a little bit extra time with you, and that's another billable unit, whatever the case may be. It is a factor that I think when you look at the organizations looking to embed some of this technology into their systems, to the opposite way as a staff therapist and embedding some of this, there is pros on both sides. And I think we really do need to understand that as a profession, right?
100%, and you are absolutely right on. So I think looking into that value creation from the clinical encounter, value being cost over outcome, right? So it's a simple equation. What is the cost versus the outcome? If you're doing something that's passive, which is you're just clicking away at your computer without looking at a patient, without actually engaging with the patient, that 5 minutes of time spent passively documenting is 5 minutes taken away from the patient encounter, taken away from the value that you can create by actually taking care of a patient, engaging with the patient, and do something of high value, which is updating an exercise program, which is providing hands-on care, which is, again, continuing to counsel patient and educate patient, so that 5 minutes being liberated doesn't have to be into something that you just jam an extra patient in. But it is 5 minutes of value-based time, which you can provide that value to the individual, to the consumer, that the consumer then will be able to resonate with and see that the value was created, and that there's another economic lever, which is the willingness to pay. And as a consumer, especially in a service-based industry, the willingness to pay is somewhat arbitrary based on the perception of, was this encounter valuable or not?
Right.
And so if you are interacting with a patient and you are engaging in something that's patient-centered, I would, as a consumer, would be willing to pay for that. Versus if I feel like out of the 30-minute encounter, 5 minutes were spent with me staring at someone clicking at a computer, that creates a much lower willingness to pay, because I don't see that as something that's valuable, that created value to me in my encounter. So yeah, Minal, you're absolutely correct that it's not just like about volume, but it's about value, right? And the value is created through this patient-centered encounter. So let's play a game of future thinking and developing, where this is by no means where we may or may not be. But if you look into how some of the larger hospital systems have used digital scribe features, and if you look into the satisfaction rates, where like there's companies that are integrating into these billion-dollar enterprise, and digital scribe has been celebrated because quality of life for the professionals improves when they're using features like digital scribe. So as a thought experiment, or I guess as a role play, how can clinicians use this now newly liberated time in their life, right? So you no longer have a therapist potentially schlepping their computer home so they can spend
Yeah.
another hour and a half clicking away from the notes from the day. What would that clinician do in that hour and a half of time that's created? I don't know. Like, why would we ever want to save that hour and a half of your time doing notes to something else, right? So,
Right. Yeah. It's an amazing opportunity, I think, for clinicians, providers to really understand. We've talked about this in our previous podcast, burnout and, people going into the non-clinical roles and this and that because of this, like basically this, threshold that we got to where you're feeling as if there's no more to give, right? As a provider, there's just no more to give because there's 10 million things that you're juggling while you're seeing the patients, but at the same time, then when you get home and you've got to do other things as well. And so this idea of, hey, I've got an hour to now use for myself or my family or my hobby or my continuing education, or just thinking about what patient caseload I have and how I can improve that, outside of just being, in front of my patient and trying to think of it that way. So personally, and this may just be a very, very optimistic view of from my point of view, but personally, I think this is something that really can bring us back to, as a profession, what we were made to do, which is affect this patient whole body, not just one joint, whole total care for their systems, and see them through their current, phase that they're in, with high impact, not just, hey, we improved one part of your issue and now you're going to go home and, 6 weeks later maybe develop another one. No, this is high value, high impact, total body, total kind of systems, which is what we're made to do as physical therapists. We have so much knowledge, we have so much clinical background, we have so much impact that we can do outside of just even MSK, musculoskeletal specifically, that this will allow us, some of that time to be able to think outside of the box and get different inputs and talk to other providers. I mean, as a provider myself, as a clinician myself, I'm the expert in the MSK world. This patient of mine that's also suffering from some cardiac issues, maybe also suffering from some, systemic issues, for time for me to talk to their providers that are, taking that care on for them, for that patient, collaborating with them, understanding what this patient's needs really are at the very, kind of basic level, to some of the more professional level with the other providers. That's what we should be doing, right? We should be at that level of care and at that level of profession with other providers in our space as well. So I just think there's so much opportunity for this to really help us as a profession to get to where we always knew we should be and we want to be. It's just we've had to be kind of, we've been bogged down, right? We've been brought down a little bit from external factors.
Absolutely. So this is a liberating tool, right? It liberates you to do what you're trained to do, which is to provide high quality care, take care of individuals, use your skill set as a professional to deliver this musculoskeletal care to a consumer who obviously needs it. And there's an immense opportunity, I think, to use this liberated time, liberated energy, to take care of self, because burnout really is real, and clinicians really do need to preserve their state of self, state of wellness, but also liberate your passion for your profession to see this as a tool that allows you more time and more resources to actually focus on an individual, which is a patient, a consumer, and how you can help this individual through your skill set. So there's just an immense opportunity to continue to build on this tool and to continue to integrate this tool into a clinical workflow so that you understand this. I think one really feature that we should discuss quickly is the preparedness of an individual. Like, oh, I think exploration, exploitation, right? So clinicians that are curious really need to find a way to SPRY website, or they need to find a way to a SPRY agent to really explore this feature and to interact with this feature, because then exploitation comes at a place where even if you don't have direct agency in getting this tool in your hands, you have the capacity to speak up on this instrument being available so that whoever has the consumption power can then integrate this tool. So,
Yeah, absolutely. The SPRY Scribe feature is up on our website. We can link it on the podcast here as well. We encourage any of our prospects that come onto calls with us, and any clinicians that we have conversations with, to go ahead and use it, test it out, give us the feedback. We can see the sessions on the back end, and how you're experiencing them, and if there's anything that we need to do to help you, kind of become more efficient at it, we will do that. So highly encourage clinicians to definitely get on there and test it out and see how it functions for you all.
awesome. So then I think this is the part where we have to give a teaser to the next episode. And it's so hard. There's so many wonderful topics, and I think that the previous two episodes where we had just a terrific discussion on the burnout, but then we also had a wonderful guest, Anang, really talk about some of the functions of U.S. musculoskeletal industry. So I think this would be actually a good opportunity for our audience who are listening to this podcast to provide us some information and actually give us some insight. What would they want to hear? Because I think based on the narrative, and based on the design of podcast, it's a conversation which allows information to escape into a larger realm. So it's a pleasure having this conversation, but the audience can really direct us into what they would want to hear, and we will design it around this to make it, I guess, interactive, so that it serves a greater purpose to our audience.
Yeah, that's a great idea. Our audience being, you know, of the profession that obviously has you all know what it is that you want out of this profession and where you want it to go and what you want to see and what is existing out there. And any feedback, any, discussion points, we're happy to have that on our end.
This has been a wonderful treatment now, and as always, it's a terrific conversation.
Always with you, Dr. Alex. Appreciate your time.
Dr. Minal, same here.